Can I come in?
Yes.
Hi, my name is Shalora Sleepy. I'm one of the nursing students here at Moraine Valley Community College. Just gonna wash my hands real quick. Can you tell me your first and last name?
Trinity McBee.
And can you tell me your date of birth?
August 10th, 2006.
Okay, I'm just gonna check your ID then. August 10th, 2006. Okay. I am here to do a head to toe assessment on you. So first, I'm going to ask you a few questions. Um, can you tell me today's date?
December 10th to December 8th, 2021.
And can you tell me who's the president?
Joe Biden.
Can you tell me where you are?
The doctor's office.
And can you tell me why you're here?
For a checkup.
Okay. So, patient is alert and oriented times 4. Patient is appropriately dressed for the season. And body posture is relaxed. Patient is there's no body odor. Patient appears to be well groomed. So I am going to start your head to toe assessment, and I'm going to start on your head. First, can you tell me, do you have any headaches, any migraines, any trouble seeing?
No.
No. All right. I'm just going to look at her shoulders. Can you sit up straight for me? So patient's shoulders are symmetrical. There is no um, deviation in the shoulders or unevenness in the shoulders. Patient's posture is relaxed and regular. Okay, so first I'm going to start, I'm going to inspect her head. Looking at her head, it's nice and round, and there does not appear to be any type of lesions or no type of lesions or masses. So first we're gonna inspect your scab. We're gonna inspect it for any type of lice or any type of parasites. Hair is evenly distributed throughout the head. There is no alopecia noted. Scab is appropriate for her ethnicity as well as her skin tone throughout her body. So next I am going to palpate for any type of lumps, any type of bumps, any bruises, any tenderness, looking for any type of lesions or wounds. Is there any tenderness?
No.
No tenderness noted, and no parasites, no lice. Next, I am going, can you sit up straight for me? There we go. Next, I am going to look at her um, eyebrows. Her eyebrows, the hair is evenly distributed. Can you raise your eyebrows for me? And they both raise symmetrically together. There is no scarce hair with the eyebrows, and her eyeballs are symmetrical. They are appropriately in her orbit sockets, and her eyelashes is evenly distributed. Next, I am going to check her perler. Okay. So what I want you to do is I'm just going to have you look forward, and I'm just going to check your pupil size and if they are retracting into light. Okay, pupils are equal and round. Next, I'm going to have you follow my pen. Sit up straight for me and follow my pen and do not move your head. Okay. Patient pupils are equal, they are round, they are reactive to light, and they both accommodated. Next, I am going to look at her eyes. Her eyes are symmetrical in her urban sockets. There is no facial droop noted. And first, we are going to look at her conjunctiva. It's nice and pink. There's no paleness. There's no lesions, no drainage, and no redness. Look at her lacrimal glands. There is no redness or drainage or swelling or lesions. The sclera is nice and white. There's no redness or any type of swelling or any type of drainage from the eyes. Next, I am going to look at her nose. Her nose is symmetrical and there is no drainage. Are you having any trouble, any runny nose, stuffy nose? No. Okay. So I'm going to check inside of her nose. First, can you hold one nostril and just check in the patency and blow out? Check the other one. Blow out. Was that okay? The patency, both nostrils is patent. There's check inside. Check your ear back on. All right. Mucous membrane is nice and pink, and there is no drainage, no redness. There is no deviated septum. There's no deviated septum. There's no drainage, no redness, no swelling. Next, I am going to check her mouth. Her lips are nice and pink and moist. There's no cracking. There's no lesions noted on her lips. Can you smile for me? Big smile. Can you puff out your cheeks? Okay, and can you open your mouth for me? All right, so we are going to check inside. There's no missing teeth. There's no missing teeth. There's no decaying teeth. You do not wear dentures, right? All right, can you say ah? Uvula is midline. Tonsils is +1. No swelling, no redness. Buccal mucosa is nice and pink and moist. Hard palate is intact. No white patches noted. Hard and soft palate is intact. Can you raise your tongue up and down, side to side? There's no lesions noted, and the buccal mucosa is nice and moist and pink. Next, I am going to check her ears. First, I'm going to do the whisper test. So what I want you to do is, when I say something, I want you to repeat back to me. I'm going to whisper, so I want you to repeat it back to me, okay?
Garbage.
patient correctly identified the words that I whispered, so there's no deficits in her hearing. Next, I am going to check her ears. Alrighty, and first I am going to inspect her ears. There is no redness, there's no drainage, and I'm not seeing any type of lesions. Alright, I'm gonna palpate the pinna, and lobia. And there is no drainage, no redness. The tympanic membrane is intact, and there is no lesions. This side, I'm going to palpate the pinna, the tragus, the lobia. And we're going to look inside. Let's see here. There's no drainage, no swelling, no redness, and the tympanic membrane is intact. I'm going to do the tragus. Is there any tenderness there? No. Okay. Next, I'm going to do T&J. Can you open and close your mouth for me? Side to side. No crepitus noted. Next, we are going to check her vital signs. So we're going to start with it. We're going to do her blood pressure. We're going to do her pulse, her apical pulse, her radial pulse. We're going to do her respirations, her oxygen saturation, and her temperature. Alright, we're going to check her temperature first. And we're going to put the temperature probe in her sublingual buccal pocket. Can you open your mouth for me? Alright. Temperature is 98.2. It's normal and it's within normal limits. Next, we are going to check her blood pressure. And we're going to check her blood pressure. I will put the cuff on and I will palpate her brachial pulse, and I will pump it up, pump the blood pressure cuff up, and when I feel the brachial pulse stop, I will notate the number that it stopped at, and I will go 30 mmHg above the number that her brachial pulse stopped. Her blood pressure is 118 over 75, which is normal, within normal limits. Next, we are going to check her pulse rate. I'm going to check her radial pulse. I'm going to be checking her radial pulse for 30 seconds, and I'll multiply it by 2. Radial pulse is 76, and it was +2, regular and strong. Next, I'm going to check her respiratory rate. Sit up for me. I will look at the inspiration and expiration, and I will count it for 15 seconds and multiply it by 4. And her respiratory rate is 16, and she doesn't appear to be in any shortness of breath. She's not using any accessory muscles. There's no retractions, and there is no nasal flaring. Are you having any shortness of breath? No. Next, I am going to check her oxygen saturation on her finger. Her oxygen saturation is 100%, and she's on room air. Next, I am going to palpate her. We're going to look at her shoulders. First, I'm going to look at her shoulders. Her shoulders are are symmetrical. There's no deviations in the shoulder. We're looking at her trachea and her sternal notch. There's no, it's midline. There's no deviation in either. Next, I'm going to palpate her carotid arteries, her carotid pulse. That is strong and +2. That's strong and +2 bilateral. Next, can you turn your head side to side, assessing range of motion, up and down, and circumduction. There is no preferences. I'm going to test her muscle strength in her neck. Can you push against my hand, this side, forward, backward, and muscle strength in neck is nice and strong. Next, I am going to listen to her lung sounds, and I'm going to listen to her heart sounds as well. Are you having any cough, any sputum? No. Just sit up for me. Alright, so I'm going to listen to her lung sounds. I will listen underneath her shirt. Breathe in, take some deep breaths for me. I'm also going to listen to the posterior lungs. Take some deep breaths for me. Deep breath. Deep breath. Deep breath. Deep breath. There are no adventitious sounds heard, no crackles, no wheezing, and lung sounds are clear throughout all 5 lobes. I'm going to check her tactile premises. I'm looking at her shoulders. They are symmetrical as well. There's no deviation in the shoulders. Can you take a deep breath for me? Another deep breath. And both my hands expanded symmetrically together. I'm going to check your CVA tenderness. So I want you to tell me if there's any tenderness when I'm percussing, okay? Any tenderness there? No. Tenderness? No. Tenderness? No. Tenderness? No. Okay, there's no tenderness on the CVA. Can you turn around for me? I'm also going to do her tactile premises in the posterior. The anterior. Did the posterior. Okay, breathe in for me. out, then, and both hands expanded at the same time. There was no, it was even and symmetrical. Her thoracic cage is a, from this angle. Thoracic cage is a 1:2 ratio, and it is oval. Next, I'm going to listen to her heart sounds. Excuse me. So first, we're going to start with the second intercostal space on the right side. This is going to be the atrial valve. Do the second intercostal space on the left side. This is the pulmonic valve. Third intercostal space on the left side, near the sternum. This is the Erb's point. Fourth intercostal space on the left side near the sternum. This is the tricuspid valve. Fifth intercostal space on the left side, mid-clavicular line. This is the mitral valve. There are no extra heart sounds heard, no murmurs, S1, S2 heard, and there were no, the heartbeat was regular and strong. I'm going to assess her apical pulse, and I will listen. Can you sit up straight for me? I will listen to her apical pulse at the fifth intercostal space, mid-clavicular line, for 1 minute. I would also palpate her radial pulse and compare the apical pulse and the radial pulse for the pulse deficit. No pulse deficit noted. Can I have you sit back? I am going to check for any jugular vein distension. I will have her at a 45-degree angle, and I will have her turn her head to one side, and I am checking for the jugular vein distension. There's no distension noted on the left side. And if you could turn your head the other way. And I will have her turn it the other way, and there is no distension noted on the right side. Next, I am going to check her capillary refill in her fingers. Less than 3 seconds. And in her legs, her toes. Less than 3 seconds. I'm going to palpate her pulses. Radial pulse is strong +2, regular. Femoral pulse is strong +2, regular. Popliteal pulse is strong +2, regular. Dorsopedial pulse is strong +2, regular. And posterior tibial pulse is strong +2 and regular. There is no edema noted. There is no edema present. Next, I am going to check her abdomen. Can you lay down for me? Okay. First, I'm going to inspect her abdomen. There is no petechiae, no striae, no bulges, no pulsations, no lesions, no noted masses. And I am going to listen. I'm going to auscultate her vowel sounds. Right lower quadrant, vowel sounds are active. Right upper quadrant, vowel sounds are active. Left upper quadrant, vowel sounds are active. Left lower quadrant, vowel sounds are active. Are you having any chest pain? Any shortness of breath?
No.
Any constipation or diarrhea?
No.
How was your when was your last bowel movement?
Today.
And how was it? Was
Small.
it soft? Was it, what color was it?
No.
Was it diarrhea? Was it hard?
No, it was like soft.
Soft. Okay, and then I will also assess her genitalia area. I will be looking for any type of drainage, any foul odors, any redness, any swelling, any lice. Next, how is your urination? Are you having any burning, any tingling?
No.
Are you in any pain?
No.
And when you urinate, what color does your urination usually be?
Yellow.
Yellow, any foul odors?
No.
Okay. So there's no presence of any type of drainage or any type of lesions or redness or any lice. Next, I am going to have you sit up. Can you sit up for me? Well, you know what? Stay right there. I'm sorry. I just want to assess one thing while you like this. Can you raise your legs for me? Okay, can you raise it back down? Okay, can you flex your legs for me? Extend. Abduct. Abduct. Can you, I'm going to check her upper extremities. Can you, let's make sure they can see. Can you push back? Go forward. Can you abduct? Abduct. Right, and then with your feet. Can you pull back, push back, and can you circumduct your ankles? All right. Can you sit up now? Can you flex out your arms? Extend out your arms. Extend. Flex. Abduct. Abduct. Circle. Circumduction. Alright. And your muscle strength is strong. There's no weakness. There's no type of deformities. No loss of any limbs. You just put your feet straight down on the floor. Legs and arms are symmetrical. Okay, I'll have you stand, please. And can you just go back a little bit? I want you to walk toward me. Okay, I'm just gonna check her gait. Can you come toward me? Can you walk toward me, please? Okay, can you walk back that way? Alright. Can you come back toward me this way? Alright, next I am going to check her for the Romberg test. You just stand with your hands to the side, close your eyes for 30 seconds. And I'm just checking for any type of swing or any type of unsteadiness. Her gait is okay. I'm good. You're good. Her gait is good. There's no unsteady gait. And there's one more thing I want to check that I did not check. I'm going to palpate her lymph nodes. Checking for any type of swelling or tenderness. So we're going to start with the tonsillar. There's no tenderness. Is there any tenderness? We're going to start with the tonsillars, the submandibular, submental, posterior cervical, interior cervical, clavicular, occipital, postauricular, and preauricular. Was there any tenderness?
No.
No tenderness noted. There was no swelling, no tenderness on the lymph nodes. Is there anything that you need from me?
No.
I am done with my assessment, and if there's anything, I'm going to leave your call light right here. If there's anything that you need, you can just press your call light, okay?
Okay.
All right, thank you. That concludes my assessment.